observed patients who cannot get coverage, whose health problems are suddenly, who are being told your insurance doesn't cover this. We dealt with disruptions in reimbursement from insurance companies, and yet huge profits. I think there are fundamental flaws in our health insurance programs that exist today. Now, whether the government option is the right way to go, I think we have to have an open mind. It may very well be an insurance cooperative that is nonprofit, but there needs to be a catalyst for bringing the cost of health care down. Now, Congressman Bachus has cited some evidence suggesting that our health care system performs at an outstanding rate. We have serious problems in our health care system. Our infant mortality rate in this country is one of the highest of the developed countries. Our life expectancy is one of the lowest of the developed countries.
Well, wait. Let's please allow Professor to have his...
So, Mike.
Now, come on now. Listen, we have been, everybody's been respectful to now, and let's not let one incident mar what we have had as I think, a wonderful expression of an American democracy at work.
So, I'd like to ask the question, Congressman Bachus, that our current reimbursement system for health care is predominantly based on numbers of patients seen, numbers of procedures performed, and yet we have incredible amount of data, the need for much more, about quality. Why aren't we shifting more to a quality-driven reimbursement system instead of quantity?
Yeah, Professor, let me say this. These are questions that need to be addressed. I do want to say this to you about the infant mortality. Now, this is sad, but one of the chief reasons that we in America have high infant mortality, and you've seen this at UAB, is drug abuse. It is one of the factors, and UAB has actually done studies. In fact, if you've been to Children's Hospital, one of the saddest things you'll see is some of the little children that are born whose parents were addicted, and drug addiction is driving parts of these costs. Now, not all, but it is a cost. It's not the problem alcoholism is in Russia, but it is, we as a country abuse illegal drugs and legal drugs. But anyway, thank you.
Let's give ourselves a hand tonight. We've got over 3,000 people from the 7th Congressional District that have come out to share their opinion with the rest of the world. And I commend you all because it's been a long night, but it's been a great night. And pardon me for interrupting you.
All right, we're going to take 2 more questions. Is that all right? And let me say this, Professor. I would like to sit down with you and see if there's some areas, because I think some of the problems, our problems. One is lack of competition. I do agree with that. I mean, there is a lack of competition. He said pooling agreements. I'm on legislation that would allow some of that. I think there are some things that we all could agree on. Tricia Crappett from Indians. Is she here? Okay. And while she's coming, is Curtis Bryant here? Curtis Bryant? Okay, go ahead.
Thank you so much for coming tonight. I think everybody here appreciates it. My question has already been answered. It was also about the why should we cover the illegal immigrants no matter where they're from when they're here. But I'll ask another question that you also touched on. I know that there is a bill that has been put forward by a congressman from Louisiana that has that does state that should healthcare reform, this bill pass, all of the Senate and Congress will automatically go on that same
Right.
exact plan.
Right.
I wonder how many Democrats have signed that bill, if any. I did see that it looked like all Republicans to me when I went to his website, and I did sign the petition as well for his sponsorship of this.
Right, and I am sponsoring that legislation. You probably saw that.
Yes.
But, and I'm not sure. It's HR what? HRES 615. Okay, here we go. Members of Congress who vote for government-run plans should enroll in the plan and give up their private insurance. It was introduced by Representative Fleming. Okay. Ms. Castable from, well, doesn't have an address here. Therese Castable. We're going to go till we get, and this will be the last question. Mr. Green? Oh, okay, I'm sorry. Oh, you don't have a question? Okay. Chuck Green? Chuck Green? I'm sure we're ending because we're all sheer exhaustion. That's probably not a bad state to be in. Nora Manderson. Nora Manderson. Oh, okay. All right. Let me say this on abortion. This year, the Congress has started voting against, for the first time, for the taxpayer support of abortions, which I think is awful. There was an amendment in this bill to exclude mandatory abortion coverage. There was